So let's talk about hereditary spherocytosis. So hereditary spherocytosis is one of the causes of anemia, and it is an autosomal dominant condition that occurs because of the RBC membrane defect. So what does that mean? So we have for example, this is the red blood cell, and then it has cytoskeleton, and this is the cell membrane, and these are connected by a bunch of proteins. These are called cytoskeleton membrane tethering proteins. So this is a protein, this connects the membrane with the cytoskeleton. This is another one, it connects the membrane with the cytoskeleton. So the names of these are a lot. So most commonly defective include enchirin, spectrin, and band3. So now let's imagine, so when there is a defect in these proteins, these cytoskeletal membrane tethering proteins, then this membrane will be prone to be lost. And that's exactly what happens in hereditary spherocytosis. So when this is lost, this is defective, a membrane bleb will be formed. There will be outpouching of the membrane, and that membrane will be lost. And when that membrane is lost, over time, the central payload will be lost. Because remember, the central payload that we see this is the central payload. This is a normal red blood cell, and this occurs because the surface area of the cell membrane is more. Okay, there's increased surface area and there's more membrane. In hereditary spherocytosis, the cell membrane is kind of lost. When it is lost, then there is decreased surface area and there is decreased space, okay, to occupy all of the content that is in the red blood cell, and so it will adopt the shape of a sphere. So hereditary spherocytosis, we won't see any central pallor or central depression. It will not be a biconvex disc. It will become a sphere because we are losing the membrane here. We are losing the membrane, and we are going to lose the central pallor. The central pallor is because of the increased membrane. When the membrane is lost, the surface area is decreased, then that will result in a sphere formation. And this is the main theme in hereditary spherocytosis. This is the main cause. If you understand this, then you're gonna understand the rest of what this hereditary spherocytosis is all about. So now let's talk about the spleen here. So the clinical presentation is a classic triad of hemolysis, jaundice, and splenomegaly. So let's talk about them, how the sphere kind of creates all of these problems. So the spleen is located, so let's look at a little anatomy. The spleen is located in the left upper quadrant, and this is the location of the spleen. And the spleen, the red pulp, we have something called the splenic sinusoids, and they're really small. Like they kind of don't let even the normal red cell to pass through it. But the normal red cells have something called deformability. So if this is a normal red cell with a central pallor, it has something called deformability because it has more membrane and it is deformable, and so it will kind of squeeze through the splenic sinusoid and get out the other way victorious. But it will emerge victorious. But what about our sphere? So the sphere cannot go through these splenic sinusoids, and the reason for that is because they are less deformable. We're losing the membrane, and it is kind of a sphere. It's like a sphere, so it cannot go through it. So imagine this this is deformable, like it will fold and squeeze through the splenic sinusoids. But this one, just look at the shape, you will know that it is not deformable. It's a sphere, so it cannot go through. So what will happen? So these spheres, the spherocytes, they are going to accumulate here in the splenic sinusoids. The first thing so they over time will lead to splenomegaly because there is a lot of it just clogging all of the splenic sinusoids. Number second thing, the splenic sinusoids are lined by something called the splenic macrophages. So these yellow thing here, these are splenic macrophages, and they are going to eat all of the abnormally shaped red blood cells. Spherocyte is abnormal, So the macrophages are going to think that we've got something to eat, and so they are going to eat it. So when they eat the spherocytes, they will break the hemoglobin down. And when they break the hemoglobin down, they will first convert the hemoglobin into biliverdin, and then biliverdin into bilirubin, indirect bilirubin. And that indirect bilirubin has to go to the liver to be converted into direct bilirubin. So indirect bilirubin means it's unconjugated. Indirect means conjugated. But there is so much hemolysis that is going on here. And this is extravascular hemolysis, by the way, because it does not occur in the blood itself, inside the blood. It actually is occurring here in the spleen. So unconjugated bilirubin is converted to conjugated bilirubin by the liver. But here, so much hemolysis is going on that the liver, it cannot convert into conjugated bilirubin. So this will result in indirect hyperbilirubinemia, and that will result in our second presentation, and that is the jaundice. And the third is hemolysis, because there is extravascular hemolysis. So that kind of completes our triad here, the clinical presentation: hemolysis, jaundice, and splenomegaly. So now we talked about all of the pathology and the clinical presentation. Now let's touch a little on the diagnosis. So obviously the first thing that you're going to do is order simple CBC, and that will tell you that there is increased mean corpuscle hemoglobin concentration. And the reason for that is because we're losing a lot of membrane. Again, all of these things are explained by the loss of membrane. Okay, so now just a quick question, like why do the red blood cell have a lot of membrane and increase? The reason for that is because it increases the surface area, and that increases the surface area will help in gas exchange. Okay, so that is why we have a lot of surface area. So now when the membrane is lost, the central pillar is lost, and the cell becomes a sphere, then that will result in increased concentration of the hemoglobin, because look, the volume inside the cell is the same. We're losing the membrane, so it will get more concentrated. The inside of it will be more concentrated, so hemoglobin concentration is going to increase. It will be greater than 36%. Then on peripheral smear, you will see spherocytes. Okay, so there is one other condition that can also present on a peripheral smear with spherocytes, and that is autoimmune hemolytic anemia. How do you kind of rule that one out? You're gonna do a Coombs test. Okay, if that is positive, it means that is most likely autoimmune hemolytic anemia. And then another test that you can do is acidified glycerolysis test. So because of the cytoskeletal membrane tethering protein defect, these cells, the spherocytes, will be more prone to lysis. So when you put them in acidified glycerolysis test, the water is going to enter the red cells, and they will cause lysis of these cells, and the fluid will be kind of turbid, and so a normal cell will not kind of easily be lysed by this. So that's another test for diagnosis. Then in treatment, you are going to give, number one is folic acid. Everyone should be on folic acid supplements. The reason for that is because when you have increased hemolysis, then you need to generate more red blood cells, and in order to generate red blood cells, you need nutrients like folic acid. Folic acid is needed for synthesis of DNA, and so folic acid supplements should be given to all. Number second is blood transfusion. Okay, and it is only required when there is really severe anemia. Then the last resort, like when nothing works, then the last resort will be splenectomy. So we talked about the main thing that is hemolyzing, that is kind of creating all of these problems, is the destruction in the spleen, extravascular hemolysis. So that is important. Okay, so this is the last resort, and splenectomy is usually not just done upfront, like directly after diagnosis, because there are a lot of complications that occur after splenectomy. So in order to do like splenectomy, you have to first give like vaccinations. The patient should be vaccinated against pneumococcal vaccines, and also H flu vaccines. So patient should be vaccinated. So that was a quick discussion of what hereditary spherocytosis is all about. And by the way, it is a form of anemia. Obviously, it is a normocytic anemia because it's hemolysis. And so, just a quick definition. It's important to know what anemia is. And anemia is basically it's a qualitative or quantitative decrease in the red blood cell number. So, or decrease in hemoglobin. So most people would say like anemia is just a decrease in number of red blood cells. It's like no, there can be like a qualitative or quantitative quantitative decrease in the red blood cells. So it's not just the number. So the quality also matters. So so hope this was helpful.